We're delighted to be joined by Stan Brock, who's the founder of Remote Area Medical. He's here in London tonight for the UK premiere of the film Remote Area Medical, about the organisation he founded back in 1985. Stan, we're delighted to have you join us.
Well, thank you, and the Royal Society of Medicine for inviting me and making it possible for me to come over here.
It's great to have you here. Could you tell us what it was that first inspired you to create Remote Area Medical?
When I was a young teenager, I was a vaquero or cowboy on a vast cattle ranch on the Brazil border of what used to be British Guiana. And I was given a very bad horse to ride, a wild horse, and I had a serious accident with the horse. It almost killed me. And when they pulled me out from underneath the horse, one of the vaqueros said, well, the nearest doctor is 26 days on foot from here through that narrow trail in the rainforest where you can't take the horses. And I told that story to the sixth man to walk on the moon, astronaut Ed Mitchell, and he said, gosh, I was on the moon and I was only 3 days from the nearest doctor. Well, those people who lived in that neck of the woods where I grew up, or the millions of people in the United States who can't afford or don't have access to healthcare, they might as well be on the moon for the opportunity that they have. So that's what started the remote area medical concept in the United States.
The system relies on over 80,000 volunteers who kindly give their time, and it's remarkable what your organisation has achieved through sharing of skills and expertise. Do you feel this is sustainable and can grow, or do you feel this organisation and the healthcare it delivers has reached the capacity of what it can do?
No, it hasn't reached anything like the capacity. It's limited only by the number of volunteers you can get and the amount of equipment that you have. And the limitations for that, obviously, are how much can you generate in terms of donations from the public. Because we do not ask the government for any money. It's never been offered, I might add. But we don't ask the government for any money. We wouldn't take any money from the government. So this is driven by volunteer contributions at no cost to the government and no cost to the taxpayer. But our numbers of patients, in fact, are on the increase, not on the decrease. So the need is still there.
There are 44 million people in the United States without health insurance, and it's one of the best healthcare systems in the world if you can afford it. Do you think the health system can change over the coming years?
Oh, not over the coming year, no. There's too much opposition from the Republicans against the Democrats and vice versa, that they just reached a point when they're bound not to agree. And of course we've got a national election coming up, not for a new president, but a lot of the Congress seats in Congress and in the Senate are going to change in November of this year. We have no idea how that's going to change, but I don't think it's going to matter, because nobody has a sufficient majority to balance it one way or the other, unfortunately.
Stan Brock, thank you so much for joining us.
My pleasure. Thank you for the invitation.
We're delighted to be joined by Leigh Daynes, who's Executive Director of Doctors of the World here in the UK. There has been a tremendous amount of reform and change and discussion about access to healthcare in the UK, especially surrounding the issue of migration. What changes and developments do you think there will be over the next 12 months?
Well, as Doctors of the World, we're especially concerned about the impact of those proposed changes on the role of a doctor. A doctor's first responsibility, of course, is to treat the patient in front of them. We're very concerned that doctors will be, in effect, required to act as border guards to check the immigration status of their patient, which for medical ethical reasons alone is totally unacceptable. And in fact, already we're seeing the consequences of those proposals in our clinic in East London, with many more patients coming saying they've been refused GP registration because of these new regulations. Now, those new rules have not yet taken effect, but clearly it's having an impact. And our patients are already extremely vulnerable. They are highly excluded and they desperately need to see a doctor. And they're not tourists. Our patients live here on average for 4.5 years before they seek a doctor's help.
I work as a clinician in London and I find it confusing even as someone who's interested in these issues. What do you think we can do to increase awareness among clinicians about who is eligible for care and when?
I think the very unfortunate thing for clinicians is the system currently, it is confusing, and clinicians are put in a desperately difficult situation because the eligibility rules, particularly for GP registration, are confused and confusing. So there's a job of work to be done to understand the current regulations and those that are coming, and doctors should not be compromised in that work. There's also a job of work to be done for doctors to come together, to mobilise, to say, first and foremost, we are doctors. It's our job to treat the patient in front of us without discrimination, and there are some aspects of these proposed changes that we think will compromise the doctor-patient relationship. So it's about the not-for-profit community that I represent coming together with clinicians to stand up and speak out to make sure that any future changes do not compromise the doctor-patient relationship.